Even though exercise is overwhelmingly effective in helping to manage blood sugar and improve general health, for some people with diabetes, the thought of starting an exercise program may be a bit scary, and for good reasons. This video is going to cover 12 steps that people with diabetes can take to help to make sure that they're exercising more safely. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise can be used as a way to prevent diabetes and many of the complications that oftentimes come along with this condition. This video is mainly going to cover some of the most recent guidelines from the American Diabetes Association and the American College of Sports Medicine as of August 2022, and it might need to be updated as the science continues to evolve. The first step is to get clearance from your doctor to exercise. Even though for some people with diabetes who are wanting to start just light to moderate physical activity like fast walking, it might not be necessary for them to obtain a doctor's clearance, but it's best to be cautious and have that discussion with your doctor anyway. And while you're having that discussion, you can also discuss with them the different topics that I'm going to be covering today and get their recommendations on it. Step 2 is related to any type of medications that you may be taking for your diabetes. When you have this conversation with your doctor, ask them if there are any type of adjustments that need to be made to your medications related to exercise. Exercise is very good at lowering blood sugar. And so if you're already taking medication that also lowers blood sugar, we just want to make sure that the blood sugar doesn't get too low because of exercise. After you've been cleared to exercise by your doctor, and you've had the discussion with them about your medications, the third safety step to take is to make sure that your blood sugar levels are within the target range before you start exercising. Blood sugar levels should be between 100 to 250 milligrams per deciliter before you start exercising. If your blood sugar levels are below 100, it's best to eat a carb-rich snack and wait for your blood sugar levels to get within that target range before you start exercising. If they're over 250, then it's helpful to check your urine for ketones. If ketones are present, or if your blood sugar is over 350, don't exercise. Instead, consult with your physician and get their recommendations. If ketones are not present in the urine, then it's okay to start doing light to moderate physical activity, but high-intensity exercise or physical activity should only be done after blood sugar levels have dropped back down into that target range. If your blood sugar has dropped below 100, similar to before exercise, eat a carb-rich snack to get your blood sugar levels back into that target range. I know I'm covering the safety aspects of diabetes and exercise today, but I'm also interested in knowing what is stopping you from starting your exercise program today, so please comment down below. The fourth safety step to take for exercise is knowing the signs and the symptoms of high blood sugar, but also low blood sugar. Some of the signs of low blood sugar include feeling shaky, feeling nervous, weak, anxious, hungry, confused. You might sweat more than you usually do. You may feel a tingling sensation in your fingers or in your mouth. It can lead to brain fog, feeling confused, having a headache, and low blood sugar can also lead to amnesia, seizures, and coma. Now, it's important to recognize that a lot of times when people exercise, they're probably going to sweat. Towards the end of the workout, they're probably going to feel a bit weak. So that's why it's important to know all the different signs and symptoms of low and high blood sugar. That way you're able to distinguish what might be caused by exercise under normal conditions and what might be an indication of low blood sugar. Some of the signs of high blood sugar include fatigue and weakness, excessive thirst and urination. Your breath might smell a bit like acetone, which is similar to the smell of nail polish remover. You might experience weight loss for no explained reason. You might have a headache and difficulty in concentrating. I know I'm covering a ton of information today, but luckily I've already written a blog article that has all this information already in it. So if you take a look down below in the description, you can find a link to that blog article. The fifth safety consideration is exercise timing. Talk to your doctor about when your medications are going to be working at their peak and if you should adjust your exercise schedule so that you're not exercising at the same time that your medications are working at their peak. Because it can be an issue if the blood sugar lowering effects of a medication interact with the blood sugar lowering effects of exercise, because we don't want the blood sugar to drop too low. It's also a good idea to try to avoid exercising at night, because one thing that can happen sometimes is if you exercise at night, your blood sugar might drop too low while you're sleeping. If you have to exercise at night, just make sure that you're following your doctor's recommendations for exercise timing, medication adjustment, and any type of dietary guidelines they've given you. The sixth safety step to consider is food timing. Have a chat with your doctor or your dietitian to see if you need to make any changes to your diet in order to exercise safely. Typically, it's good to eat within 1 to 2 hours before exercise and to keep a carb-rich snack nearby in case your blood sugar starts to drop during exercise, and it'll allow you to refuel. If you're finding this information helpful so far, please give me the thumbs up and hit the subscribe button so that you can get more free content. Step 7 is have a friend or family member nearby while you're exercising in case a risky situation does happen. Step 8, don't skip the warm-up or the cool-down. These essential exercise components are even more important for people with diabetes in order to prevent any cardiovascular related complications. Step 9 is to make sure that you have the right shoes for exercise. If you have peripheral neuropathy or peripheral vascular disease, talk with your doctor about the right shoes for you to exercise in. Step 10 is to make sure that you are exercising in cool temperatures and staying hydrated. In people with diabetes, maintaining or managing the body temperature can be challenging at times, so that's why it's quite important to make sure that you're exercising in a cool environment and keeping plenty of fluids nearby. Step 11 is for those that have diabetes-related retinopathy. If this is you, using lighter intensities whenever you're doing muscle strengthening exercises will help to avoid any type of sharp increases in your blood pressure. If you don't have retinopathy and your doctor's cleared you to exercise independently, then exercising at higher intensities when doing muscle strengthening exercises, this can be very beneficial for lowering blood sugar. The last step, step 12, is to make sure that you're progressing appropriately. As long as you've been cleared to exercise independently by your doctor, the progression guidelines are similar as they are to people without diabetes. Start at a moderate intensity, make sure that you're using correct technique, and each week just gradually increase the intensity bit by bit. Now, even though there are certain safety precautions that should be taken whenever exercising with diabetes, if done properly, the benefits can be extraordinary while still managing the risks.